Chapter 2 has a few different areas of focus, the first of which is body structures. So you're going to be introduced to all the different directional terms we're going to see in the textbook. Color, there's a lot of diseases and disorders that have different colors associated with them. And then oncology, so we're going to be introduced to words that have to do with cancer we're going to see throughout the textbook. So this slide is really a refresher on the different levels of organization. It's not having any medical terms here, but we'll see them later in the chapter. So every chapter from now on is going to kind of introduce you to the basics behind the chapter title and then move into the medical terms. So this is just explaining how the basic unit of life is the cell, and you slowly work your way up to actually create a system.
So here I want you to stop and ask yourself for a second, what are the different types of tissues? Some of you may remember this from other biology classes. There's a few different types. So there are 4 main types of tissues: nervous, epithelial, connective, and muscle tissue. We're going to find that there are diseases associated with each one of these tissues, as well as medical terms associated. There's a picture of each at the bottom, and they go in order. So the leftmost one is nervous tissue. You can notice these are axons. In the middle, you have epithelial tissue. So this is like your skin. The third is connective. This is by far the most for internal body linings. It's connecting, supporting various organ structures. And then finally, muscle tissue, that's responsible for the muscle movements that we have. So here's another memory question for you. What are the different body systems? There are many different ones, and this book is going to cover all of those different body systems. So here are all the different body systems that the book is going to address. Hopefully you are able to at least think of a few of them from memory. One, for example, you might think of is, skin as a body system, but knowing that it's called the integumentary system is another level of knowledge we're going to have to work on. Notice here that they combined muscular system and skeletal system together into the muscular skeletal system, and that's going to be tackled together in one chapter later on. In your book, on page 20, there's a large table, as seen kind of the first part on this PowerPoint slide, that goes through and tells you what the organs and the main function of each one of those systems is. You're not going to necessarily have to know that right away, because each chapter will tackle a system separated by itself. The last kind of key intro material that you might need to know before we dive into the medical terms are the body cavities. So this picture is in your book on page 21, and it shows you where all the different body cavities are. This is going to be important when we talk about our directional terms, and when one doctor is talking to another doctor about certain organs or certain injuries, it's important to know kind of what cavity you're talking about. So cranial goes along with the cranium in the brain, spinal cord is in the spinal cavity. Those ones are pretty easy to remember. The thoracic cavity is pretty much everything in the upper chest down to the diaphragm. The diaphragm is kind of the separator between the thoracic cavity and the abdominal pelvic cavity. So in that upper area, there's the heart, lungs, your rib cage. Think of all those things that are in your rib cage, and including your esophagus, trachea, so your throat, and the tubes leading down to your lungs. The abdominal cavity is in the upper portion, right underneath the diaphragm. So you have your stomach, intestines, kidney, liver, gallbladder, pancreas, spleen, and the ureters, which are a part of the urinary system. At the bottom, you have the pelvic cavity, and that's really where your bladder, your reproductive organs, certain parts of the small and large intestine, and the rectum are located. There's really no physical divider between the abdominal cavity and the pelvic cavity. So sometimes it's just called with one term abdominal pelvic cavity. So at this point, we're about ready to dive into the medical terms. I would suggest just pausing and maybe trying exercise 2 on page 22, just so you have a good idea of what organs or structures are found in each cavity. So now we're finally going to get into some medical terms. Every chapter is laid out in this way. We're going to start by learning the major combining forms that go along with this chapter. Once we do the combining forms, then we're going to talk about prefixes and suffixes. We learn all of those word parts first, and then we actually get into the diseases and disorders that combine those together. In your note cards, the combining forms are all a part of the flashcards, as well as the prefixes and the suffixes. So this is the first group of combining forms of body structure. And notice in the bottom right, in red throughout the PowerPoints, you're going to find some exercises that I would recommend that once you kind of go through this slide, understand these terms, look in the book, try out the exercise. It's not going to be graded or anything, it's just something for you to do to get some extra practice. And try doing these from memory, otherwise it's not really going to help you if you just keep looking back. So starting off with a list, it's on page 23 in your book. Adeno is the key word for gland. So this could be any gland that you're talking about. It doesn't necessarily go to a specific one. Cyto means cell, so think about like a cytoplasm. We're going to learn what plasm means later, but it's the inner substance of a cell or pertaining to a cell. Epithelio, pretty easy. You can compare it to epithelium or those skin cells. Fibro goes with fiber. Histo is not really an easy one necessarily, but it's tissue. So for example, histology is the study of tissues. Karyo means nucleus. So if you think about prokaryote or eukaryote from biology class, that means before or true nucleus. So we see karyo when it's talking about cells with a nucleus. Lipo means fat. So if you think about liposuction, for example, that's taking out fat. Myo is muscle. Neuro is nerve. Organo, take a guess, organ. Sarco is kind of a tricky one. It means both flesh and connective tissue. So anytime you're talking about a disease or disorder of connective tissue, you're going to see sarco. Systemo means system, so if you're talking about a system-wide issue, system-wide disease. And viscero means your internal organs. So like your viscera is referencing those internal organs. We're going to be seeing these words throughout all of the different chapters because they're pretty general. And as you can see, some of them are pretty straightforward, like organo goes to organ. Those ones are going to be the easy ones to remember. It's the ones that aren't necessarily spelled the same way as the word that they're talking about. And another side note, remember, spelling will count on all of your assessments, so make sure that you memorize the spelling of these as well as pronunciation. So I want you to take a look at these pictures, and they're numbered, and see if you can think about what are the combining forms that go along with each one of these words. When we get to testing, we're going to find that most of the time I'm going to give you the definition like cell, and you're going to have to write the combining form. Remember, the combining form has that little slash and the combining vowel. Most of the time it's going to be O, but not always. So for example, cell, the combining form for cell is cyto. Tissue is histo, and then the third level of organization is organ, so organo, and then the final level is system, so systemo. I'd say when in doubt, just slap an O on the end and hope for the best. So here's another review question. What are the combining forms for these different tissue types? So for nerve, we have neuro. For epithelium, pretty straightforward, epithelio. And if you're tricked out on the spelling for that one, it's kind of straightforward from the epithelium word that we give you. Connective, that one's the tricky one. Connective tissue is sarco. And then muscle is myo, M-Y-O. Here we get to combining forms that are used with body structures, so we're going to be seeing these words a lot throughout the chapter. The major one, cancero or carcino, both of these words mean cancer. So throughout the textbook, there's going to be instances where you see more than one medical word meaning the same thing, like cancero and carcino. When it gets to test time, as long as you use one of them correctly, it doesn't matter which one, you will still be given credit. There's kind of one commonly used in medical practice over the other in certain situations, but I'm not going to be making you know which one that is. So as long as you use one of the words that means what you're going for correctly, that's considered okay. Etio means cause. For example, etiology is the study of disease causes. No, G-N-O, the G is silent, means knowledge. So when we talk about diagnosis or prognosis, it has to do with knowledge, and we'll get to those words a little later. Iatro means a physician or medicine, so think of psychiatrist. In the middle there's that iatro. Also be paying attention to how I pronounce these words, because it's a little bit difficult sometimes. Leo means smooth. So if you're talking about smooth muscle, smooth tissue, you might see that word. Onco, think of oncology. That means tumor or mass. So typically that's a word associated with cancer, but not always. Patho means disease. So pathology, for example, is the study of diseases. Rabido means rod-shaped or striated. So if you're talking about certain muscle types or diseases or disorders of striated tissues, you'd use this. And the last one, somato. Somato means body. So if you're talking about a full body issue, you might see this term. So take a second and do exercise 6, and this is kind of where you have to write the combining form when given the definition. If you prefer to do exercises that I'm not specifically highlighting, that's great extra practice for you. The last group of combining forms for this chapter are the colors. They're pretty easy, I think, to remember, but we're going to be seeing these throughout all the other chapters. So the first one, chloro. Chloro means green. Think of chlorophyll in plants. Chromo. Chrome is a general word that means color. So chromatography, for example, has to do with a picture of colors. Cyano is blue. Urethro is the kind of a tricky one. Urethro means red. So, for example, erythrocyte is a red blood cell. Leuco means white. So, a leukocyte is a white blood cell. And you will also see like leukemia coming in later, and we'll talk about what that one means. Melano, or melano, pronounced either way, means black. And so this, for example, think of a melanoma. It's a type of skin cancer apparently on your skin that's black. And xantho, it's pronounced xantho with an X, and that means yellow. So the condition of jaundice, for example, has another medical term, and that's where the skin turns yellow. So we have xantho as part of that medical term, and we'll see that later on. So we've done all the combining forms, and now we get to the prefixes. And these prefixes are pretty basic, so we're going to be using these throughout all the different chapters as well, and they're going to kind of build on each other. So you're going to see these a lot. Dia means through or complete. So for example, if I put it together with no as a combining form, I get diagnosis. And diagnosis, for example, means a complete knowledge, meaning you know what the disease is. Dis means a few different things. It could be painful or abnormal or difficult. So if something is not right, we often use the word prefix dis. Hyper, think of hyperactive, for example. It means above or excessive. So if an organ or a tissue is working above its normal capacity or levels, you'd see hyper. The opposite is hypo, meaning that it's below or incomplete. It's deficient in some way, not doing what it needs to be doing. Meta means after or beyond. Most of the time we're going to find that it means beyond. For example, metastasis is where a cancer has spread beyond its initial point. We're going to see that later on. Neo is new. So neonatal is a word, newborn. Anything that is a new growth, for example, is using neo. And pro means before. So I think of prokaryote, tying it back to biology, means before a nucleus, because karyo means nucleus. I'm giving you all of these example words. You're not going to necessarily be responsible for them unless they're in the chapter explicitly. I'm just kind of giving you words of reference that you might already know to help you memorize these words. This is the last chart we'll see before we get to actually combining word forms to make diseases and disorders. And this is the suffixes. This list is pretty long. When we get to later chapters, it won't be this long. Here we're introducing most of the common suffixes we're going to be seeing throughout the entire rest of the book. So it looks long and hard now, but after you see them over and over, they're going to come pretty easy to you. The first one is ALIC and OUS. All three of these mean pertaining to. When in doubt, usually the suffix means pertaining to. We're going to find that there's probably 5 other suffixes throughout the textbook that also mean this. Site means cell. Gen and genic can be a little confusing. Gen is the substance that produces or causes, and genic means producing or causing. And what I always think of like a carcinogen is a substance that could cause cancer, and carcinogenic is causing cancer. So, for example, you could say nicotine is a carcinogen, smoking cigarettes is carcinogenic. Logist and logi, you've probably seen those before. Logist is the person who studies, and logi is the study of. Megaly, think mega, big. Megaly means enlargement of, so this is going to be used oftentimes with an organ or a part of the body. Oid means resembling, so if something looks like a tumor, it might be oncoid. We'll find a lot of these later on. Oma is a tumor or a swelling, so we're going to see words like melanoma, carcinoma, and so on. Osis is a general term meaning an abnormal condition. So if there's something wrong or you're noticing something abnormal about the skin, for example, you might have osis. Pathy is the generic suffix for a disease. Plasia means growth or development. We're going to see a lot of suffixes that look very similar to plasia, so make sure you get the spelling down now. And oftentimes this is paired with prefixes like hyper and hypo when you're talking about too much development or too little development. Plasm means a substance, so if you think of cytoplasm, that's the substance in the cell. Sarcoma. So we saw sarco earlier on in the word roots to mean connective tissue, and we even see oma up on the top of the list as a suffix. Here, sarcoma, when you put it together, it means a malignant tumor. So not all tumors are cancerous or malignant, so if it is, then we use sarcoma. Cis means a state of, so it doesn't always necessarily mean an abnormal state of. That's what osis is for, and we're going to see a few words with that. And last but not least is stasis, which means control or standing. So I think of homeostasis is a state of, internal control. Here I just want to draw your attention to word roots and suffixes that look very similar, and they mean the same thing for the most part. Cyto means cell, cyte means cell. Same thing with patho and pathy, they both mean disease. The only one that's slightly different is sarco means connective tissue, and sarcoma means a malignant tumor. So I kind of mentioned that on the last slide. We're going to find this throughout the textbook as well, where word roots and suffixes could mean the same thing. So it really just depends on what you need to combine it with in order to choose the right one. So if I think of cytoplasm, I would use cyto is the word root. If I say erythrocyte, then that's a red blood cell. Depending on what other medical terms are in existence, we choose one or the other. Also, take a moment and try exercise 11. I'm giving you kind of the easier exercise of matching. Once you feel comfortable with the words, then I'd recommend exercise 12. Here, this is just showing you the difference between gen and genic. Again, gen is a substance. So, for example, a carcinogen is a substance that causes cancer. Whereas genic means producing or causing cancer. In this case, I always think of smoking. You know, the cigarettes are a carcinogen, but smoking the cigarettes can cause cancer. So that's what's carcinogenic. Okay, so we finally get to where we form full disease and disorder words. We've learned all of the word roots and the prefixes and suffixes up to this point, and now we can start to put them together. The way the book is laid out, we're going to start with the diseases and disorders that are built from those word parts that we've learned. And then we're going to tackle a separate list of diseases and disorders that are not built from word parts. And those are going to be the more difficult ones you have to memorize. This is the first of many lists that we're going to see. In this one we have oncology words built from word parts. So you'll notice all of these words are put together from the word roots, prefixes, or suffixes that you were introduced to in the beginning of the chapter. And the list looks long, but you'll notice that most of the suffixes are, a few of one or two that we've seen. So oma, meaning tumor, or sarcoma, meaning a malignant tumor. For example, you can have a fibroma, which is a tumor of, fiber, if you're going literally, or a fibrous tumor. But you could also have a fibrosarcoma, and that would be a malignant tumor of fibrous tissue. And in real life, a medical situation, you could have a fibroma tumor that's not malignant eventually turn malignant, and that would become a fibrosarcoma. But looking at some of these other words, think about how we define them from the first chapter. I always recommend starting at the end of the word, so looking at the suffix, and then you go back to the beginning of the word to figure out what the word means. For example, adenocarcinoma. I know oma, so I know it's a tumor of some kind. Adeno means gland, and carcino means cancer. So it means a carcinoma would be a cancerous tumor of a gland. And I want to point out here that cancerous tumor, a carcinoma, oftentimes means very similar to the same thing as sarcoma. The word sarcoma by itself means tumor of connective tissue. But when you see sarcoma as a suffix, it means malignant tumor. So that's kind of a confusing thing that you'll just have to memorize and keep straight. Other keywords on here, chloroma would be a green tumor, so you can put whatever color word root on there. Leiomyoma would be a tumor that is of the smooth muscle. So remember, in this case, we can put more than one word root together with a suffix. And on the slide and in the book, there's one common medical way to say it. For example, you would put Leo before Mayo. However, you're not necessarily going to know that information as you're starting to build these words. So if you had to build this word, you know it has to have Leo, you know it has to have Mayo. As long as you have both of them in either order. For example, if you said myelioma, even though that's not the common medical way to say it, it's still considered correct because you're using the right word roots. You can also have something like a melanoma, which would be a black tumor, but you can have a melanocarcinoma as well. So that would be a cancerous black tumor, meaning that it's malignant. You could also say melanosarcoma, because that would be a malignant tumor that is black. It's just more medically accurate to say carcinoma. Other things on this slide to point out, here you'll see after the word neoplasm, in parentheses there's animation, and that means if you go onto the textbook's website, there is animations throughout the different chapters that you can click on and learn about, and so that means that that particular word has an animation associated with it if you want to look it up. Another key thing is next to carcinoma, there's a CA in parentheses, and that's just telling you that there is an abbreviation for that medical term. And at the end of every chapter, you're going to see those abbreviations again in a separate chart. And you're going to be expected to know what the abbreviations are and what they mean. So you have to memorize carcinoma means CA. So at this point, I would say try exercise 14. That's starting to put together the words and what their definitions are. It has you breaking up the words and defining them. You can also try exercise 15. So whichever you think is easier at this point, going from the word to the definition or vice versa. You should be able to do both by the time the test rolls around. Here's an example of a word that looks like it's just a prefix and a suffix put together without a word root. And as you learned in chapter 1, every word has to have a word root in order to be, a real word. But in this case, we have a word root that's hidden in the suffix. So plasm is the suffix, but there's considered to have a word root kind of hidden in there. And anytime you see this instance, you're going to see that abbreviation S with a WR in parentheses. That means the word root is kind of hidden in the suffix. And these are only going to be sprinkled throughout the different chapters and specially noted. Part of this course is being able to pronounce the medical terms correctly. It's one thing to be able to read them and know what they mean, but it's a separate thing to be able to pronounce them correctly. So on page 31 of your textbook, there's a little table that gives you a few of these key guidelines. So the first of which is just the words are distorted minimally to give you the proper sound. So whenever you see the parentheses after the medical term, it's phonetically written for you to read it without having to think too hard about it. So for example, doctor, the C sounds like a K, or in other words, the C could sound like an S. So they're spelling it out for you. The second rule is kind of making you go back to first grade English. A marcone, which is basically the straight flat line above a vowel, just means that it's going to have that long vowel sound. So if you think about your long vowels, they say their name. A says A, E says E, I, O, and U. So whenever you see that long line above the vowel sound, that means you're going to actually say that vowel's name. Like in the word donate. You hear the O and you hear the A. And that's just to help you, again, pronounce these words. If there is no line above the vowel, then it's assumed to be a short vowel sound. I know this sounds silly, but you have to know your short vowel sounds too. A is A, like apple. E is E, like elephant. I is I, like igloo. O is A, like octopus. And U is like cut. So whenever you don't see a line above the vowel sound, then you use that short vowel sound, like in medical. You hear the the I, and the of the 3 different vowels. This final rule has to do with where you put emphasis in the word, or where you put accents and stresses. So wherever you want to, stress the word the most is going to be in capital letters. And if there's a part of the word that gets a little bit of stress, then it's going to be in italics. And that's just to help you pronounce the whole word all together. So for example, all together, the geth part is kind of the key one that you put emphasis on. Or if you're thinking medical terms, pancreatitis. You hear that tie part, that's kind of where the emphasis of the word lies. So in this review question, both of these words are melanocarcinoma, but I want you to ask yourself, do you remember where you split up those words? And are they labeled correctly? So looking at A and B, which one would you choose? Hopefully, you're choosing A. So both of them have oma as the suffix and carcin as a word root. But A is correct because it has the slash between the N and the O, between the word root and the combining vowel, where B does not. This chapter didn't have any diseases or disorders that are not built from word parts. So the next section has to deal with body structure terms. And again, we're going to have ones that are built from word parts in this case, and the list is going to be rather long. Here I just want to draw your attention to what we're going to experience with a few words, and it's called ellipsis. And this just means that you take out part of the medical term because it's understood. You don't have to make the medical term even longer because we already know what they're talking about. For example, erythrocyte. It means red cell, but it's understood that it's a red blood cell. We wouldn't say erythrohematocyte. That just makes it too long. Same thing with leukocyte. Leukocyte literally means a white cell, but it's understood that it's a white blood cell. So we're going to come up with a few different words throughout the book where one of the word parts has been taken out because it's understood, so you don't have to make the medical term longer. So here are the body structure terms that are built from word parts. Again, don't be scared because this is another long list. Everything that is built from word parts in this chapter comes from those that we learned at the beginning. So focus on the word roots, focus on the prefixes and suffixes, and then you can kind of put them together in any which way to understand what they mean. So for example, a cytogenic would be something that is producing cells, whereas cytoid would mean resembling a cell. Cytology would be the study of a cell, and cytoplasm is a substance of a cell. So you'll notice a lot of these are going to repeat over and over again. Another example is plasia, which means growth, and you can either have excessive or deficient growth, so that's where hyper and hypoplasia come in. Other things on here, we already talked about erythrocyte and leukocyte, but they're on here also. We have erythrocytosis and leukocytosis. And if you remember, osis means an abnormal condition. So erythrocytosis would be kind of literally an abnormal condition of red blood cells. So what that means is you maybe have too many red blood cells, or leukocytosis would be too many white blood cells. Organomegaly means that you have an enlarged organ, and it could be any organ. It's not really a specific term, it's more general. Somatic means pertaining to the body, whereas systemic means pertaining to a body system. Usually it means about a specific body system, or it could be your body as a whole. So exercise 19 on page 37 is a good example of an exercise that you're going to want to do throughout the chapter in the book. You're going to see something like this on the test as well, and it looks long, but it's very good practice, nothing that would be graded. But think about, for example, what would be a cell substance? And usually fill in the word parts that you know from memory. It's not going to be a help to you if you just constantly look back each time to find out what goes in the blank. So think to yourself from memory, can you fill in any of these word parts? When we get to the test, you'll also get partial credit if you can come up with half of the word. And once you fill in the parts you know, then go back and actually look up the parts you don't know. So maybe you know cell substance. You know cell means cyto. So you can fill in cyto, cite for the word root, O for the vowel, and then maybe you have to look up plasm for substance. Or pertaining to the body. Pertaining to the body means somatic. And so the commonly used medical term for pertaining to here as a suffix is IC. But remember, there are two other ones introduced in this chapter. Anytime you have to use the suffix pertaining to, as long as you used one of them correctly, then it doesn't matter which one. One of them might be shown in the book, but if you said somatol or somatus, technically both of those would also be correct. Once you get through the diseases and disorders in each chapter and the words that relate to that, we now get something called complementary terms. And the complementary terms are descriptors for the signs and the symptoms, as well as the medical areas of study and specialists. So it kind of is all the rest of those words that are associated with a particular topic. And these are also built from word parts as well as ones not built from word parts. Here I just want to clarify for you what is the difference between a sign and a symptom. Both of these fall under the term complementary, but they are different from one another. A sign is an objective piece of information. So it is something that the doctor actually can see when you go in to see them. For example, in this picture is cyanosis of the nail bed. And if you dissect the word cyanosis, you know that it means an abnormal condition of blue. So that's something that the doctor could easily see when you go into the office. A symptom, on the other hand, is subjective, meaning it's kind of different for every person. And it's what you as the patient would go in and say about yourself. So when the doctor asks you, tell me what's wrong with you, and you give your explanation, you're explaining what your symptoms are. How do you feel? In this slide we have pain in the chest while walking. And the way that you describe pain might be different than the way someone else might describe pain. So that's why it's considered subjective information. So the doctor would take both the signs and symptoms into consideration when they have to come up with a diagnosis for you. Here are all the complementary terms that are built from word parts. And again, we're just combining the word roots, prefixes, and suffixes that we learned at the beginning of the chapter, just in different ways. Also, we have a few new abbreviations that have been introduced, DX and PX. DX means diagnosis. And if you literally translate the word diagnosis, it means a state of complete knowledge. Cis means state of, dia means complete, and gno means knowledge. So that's how we get a state of complete knowledge. And when you think about what that means in real practice, diagnosis is when they come up with what is wrong with you. So sometimes the literal translation needs a little interpretation for the real world. Prognosis, on the other hand, You still have a state of, and you still have knowledge, but in this case, pro means before. And prognosis in general practice means what the outlook is. So it's the prediction of what the disease is going to do. Usually it would be, how long do you have to live? That would be a prognosis. Or if your prognosis looks good, maybe your cancer is going to go, into remission. Other words on here, etiology, that's a difficult one to pronounce, is the study of causes. Etio means cause. In this case, the study of the cause of disease. Iatrogenic means produced by a physician, or the unexpected results, basically the side effects from a medicine or a treatment prescribed by a doctor of some kind. And keyword we're going to see a lot is metastasis or metastasis. It can be pronounced either way. That's the singular term. The plural is metastases, and it's abbreviated as METS. And this means that literally the beyond control, but in real world it means that the cancer has spread. So it started out in one location of the body and has then spread to other areas of the body. And when that happens, it is then said to have metastasized or moved to a new location. Let's see. Organic means pertaining to an organ. Don't think of organic with a food. In this case, just look at the word root and suffix, and it means pertaining to an organ. Let's see. Don't be scared by the really long words either, like xanthrochromatic. Again, once you chop it up into the word parts, just take it one at a time, and then you can easily define what the word means. For example, xanthrochromatic, IC means pertaining to. Then you go back to the beginning of the word. Xantho means yellow, and chrome means color. So it means pertaining to a yellow color. And we also have xanthosis, which would be an abnormal condition of yellow. So this is an example of jaundice, where you have that abnormal condition of yellow. That's the medical word that means the same thing as jaundice. Take a moment now, do exercise 22 and 23 to start to feel more comfortable with these words. Here's a visual just to show you what metastasis or metastasis means in terms of the health of a person. So on the left you have cancer cells that are in one area of the body, and those cancer cells grow and divide and eventually break their way into a blood vessel. Once they're in the bloodstream, then they can kind of travel and pop out in a new location. And once they pop out in a new location and begin to grow and take hold, that's metastasis. In this picture, you have the primary tumor next to the lung, hops up on the bloodstream, travels to the brain, and it is metastasized or metastasis to the brain. This is the last major list of the chapter and probably the most difficult. This is where we introduce words that are not built from word parts. So the word roots and prefixes and suffixes that you learned at the beginning of the chapter are not necessarily going to help you here. You have to memorize these words. These are also not included in your flashcards that are given to you if you bought the textbook brand new. So if you want to have something to help remember these, you might have to make your own flashcards if that's helpful to you. So looking at this list, apoptosis is programmed cell death. You might have learned this in biology class previously. And in practice, apoptosis is normally kind of a good thing. If your body notices that there's something wrong with a particular cell, then it kind of puts it on automatic suicide to get rid of the bad cell so that it doesn't divide and spread. Benign. Benign goes with another word on the list, malignant, in regards to a particular growth or tumor. So benign means that it's not malignant or not cancerous, whereas malignant means that it is cancerous. And you can have a tumor, for example, that begins to be benign and maybe turns malignant later on. But benign is considered to be the favorable of the two. Biological therapy, and this is a treatment of cancer with biological response modifiers. Really, this just means that you are, treating cancer with some type of biological substance, whether it's a drug or chemo, for example, which is another term. You could be using radiation, other things like that. Thinking of chemotherapy, the abbreviation is chemo, and there's also an animation on the website. But chemotherapy is where you treat cancer with drugs, whereas radiation therapy, which is abbreviated XRT, the X standing for X-ray, radiation therapy, that one is where you use X-rays to try and treat cancer. And we'll learn later on, what are the differences between the two when we talk about different medical tests that can be done. Going back to another term, carcinoma in situ. Carcinoma, we learned, is a tumor that is cancerous. In situ, we haven't seen before. What that means is that it is in isolation or in one place. So a carcinoma in situ means that you do have a cancerous tumor, but it's not spread. It's staying in one spot at this point. Other terms that kind of go along with that is in vitro, in vivo. In vitro means in a test tube. So think about in vitro fertilization, for example, where you fertilize an egg in a test tube. In vivo means in a living body. So most of the diseases and disorders are going to be in vivo or in a person. Other terms, encapsulated. Encapsulated just means that it's within a capsule, kind of localized in one area or enclosed in some way. It's not spread beyond maybe the organ that it is initially invaded. Exacerbation. The word exacerbate means to make worse or increase the severity of symptoms. So if your disease is exacerbated, that means it's getting really bad really fast. Hospice. Hospice is a place kind of like a nursing home, but hospice is the place that you would go for if you were terminally ill. So at this point, there's no cure. You're not going to get better. They basically just make you comfortable in the last moments of your life. Idiopathic means that it pertains to a disease of unknown origin. So this one looks like it's built from word parts. It does have some elements of being built from word parts, but we never learned idio earlier in the chapter. So if there's a disease of unknown origin, they don't know what causes it, it would be considered idiopathic. I'm going to assume you know what inflammation is. Other terms that constantly get confused, morbidity and mortality. They kind of go together, but they do have different meanings. Morbidity is the state of being diseased or unwell. So really it's a measure of how many people have a given disease. So how many people in the United States have HIV, for example. Whereas mortality has to do with the state of being dead, or what is the incidence of death in the population from this. So morbidity, how many people have HIV. Mortality, how many people have died of HIV. Another term is palliative. This goes along with that hospice term. Palliative means that it is providing relief, but not a cure. So if there are uncurable diseases out there, certain pain medication might be used or other interventions that don't actually cure, they just kind of provide some relief. And that is what palliative means. The last term on the list is remission, and that is when you have some kind of improvement. Normally this is used for cancer, so if a cancer goes into remission, then that means you no longer have the symptoms of the disease. And that may be permanent or it may be temporary. This picture just shows you how normal cells can develop into a cancer cell and how the medical terms evolve to go along with that. So you start off with normal cells on the left, and they start to begin to divide abnormally, and then we would call that hyperplasia. So you have excessive development. And then maybe some of those cells begin to malfunction, and now you have abnormal cells growing in the localized location, and that would be called dysplasia. So now you have abnormal or defective growth. And once all of the healthy cells die and you only have abnormal cells, that would be a carcinoma in situ. So you have cancerous tumor, but it has not spread. Once it spreads, then it becomes just a general carcinoma. You could also say that it has metastasized. In this chapter 2, we have singular versus plural. I'm not really going to ask you this in a testing situation, but I just want you to be aware that there are differences in pronunciations and especially spellings from a singular to a plural ending. You're not going to be expected to memorize this table on page 49. Just be aware of the differences between a singular and a plural, and that there are spelling differences. So when you see these words used throughout the book, you understand if we're talking about one or more than one. Every chapter in the book ends with a series of abbreviations that were used for medical terms throughout the chapter. They're referenced in the full-length version of the word throughout the chapter, but then they're compiled again here for your reference. Here are the abbreviations for Chapter 2. Again, you are going to be responsible for memorizing what all the abbreviations are and the medical terms that go along with them. So some of them are easy. For example, chemo is chemotherapy. RBC stands for red blood cell. You could also put erythrocyte. A erythrocyte is a red blood cell. I would accept either. Same thing with white blood cell, WBC. You can either write out white blood cell or write out leukocyte. But you will be responsible for knowing all of these abbreviations. Exercise 32 underneath the table in the book is a good exercise representative of how you might see that in the future. At the very end of every chapter, they try to put it all together by giving you a medical document of some kind. So this is very helpful to translate into a potential real medical situation. So in this case, there's a few different exercises we're going to come across. Here is an example of an exercise where the words are put in for you already, and the key here is to read the medical document aloud and pronounce the terms correctly. This is an example where group work might be helpful. In exercise 33, you're given a document with blanks, and you have to come up with the appropriate words to go in the blanks. They do give you clues at the bottom of the page to help you figure out what word goes in the blank, but working in groups might help. And then once you have the words in the blank, try reading the document from the beginning to the end, making sure you're pronouncing all of the different vocabulary words correctly.